I found out that I had cystic fibrosis when I was a freshman in high school. My mom was driving me back home from cross-country practice, and she told me.
So cystic fibrosis is a genetic disease which you get from both your parents have to carry a gene in order for them to have a child with CF. Normally, cells that hold water and sodium move in and out freely, and you would have thin secretions. People with CF have a defective gene that causes your mucus and secretions are thicker, which in turn affect your lungs, your pancreas. It can also affect liver and reproductive organs. And bacteria love mucus, so you can get multiple lung infections. Eventually, there's damage to your lungs, which can cause respiratory failure and eventually death. The median age of survival now for CF is 51 years of age.
The first symptoms I had was actually when I was like a baby. I had a lot of lung infections and also a lot of digestive problems as a baby.
Most patients have some type of lung disease. The majority of patients have pancreatic disease, but there's a portion of patients that don't.
He ended up with, it was called bronchiolitis a couple of times, which was an inflammation of his bronchial tubes. And now knowing that he has CF, that it was probably one of the reasons why he ended up with bronchiolitis was because he had CF. He continued to have coughs when he would get colds when he was in elementary school. And his cough got worse when he became a teenager. When Michael was diagnosed, he had a chronic cough, and he would cough pretty much every night. I would hear him coughing.
As a result of getting the diagnosis, I definitely had to change my lifestyle, because one of the biggest things that with cystic fibrosis that you have to do is you have to do these lung treatments all the time. So basically it's like, oh, this machine right here, the big machine, plug it in to a vest to my chest and then it shakes me. And the idea is supposed to loosen up the mucus that's in my lungs and get it so it moves upward and keeps the infection from staying in my lungs.
It's pretty safe to say that most patients are on some type of respiratory medications. Respiratory medications being they have to either do an inhaler, some type of medication that helps to open their lungs, bronchodilators to open their airways up. Then they'll inhale, like nebulize a medicine that helps to loosen up that thick mucus to make it a little thinner so they can spit it and cough it out.
I had to make sure that I was exercising all the time to keep my lung function up too. So I've had to take different antibiotics, and different side effects of those medications have been very, very severe. And then I have to take pills whenever I eat too. And I can't just eat whatever I want to eat, whenever I want to eat. I have to be kind of strategic about when I'm eating fat, because that in particular is difficult on my pancreas. If I want a delicious brownie sundae on Sunday, then I'll know like I'll have to start planning ahead on like Friday or Saturday to go extra light on the food, especially the fat and the protein.
Initially, I had to go to many doctor's appointments.
So at a quarterly follow-up, we will check, your height. We'll check, obviously, your vitals, your height and weight, because that's a key sense in seeing how you're doing nutritionally. We have a dietitian. So on our team, we have a dietitian, a nurse coordinator or a clinic nurse, physician, a respiratory coordinator, and a social worker. So all these people you will see at every visit.
I was at the doctor's once or twice a week when Michael first got diagnosed. He had to have a sinus surgery. In addition to that, there were 2 times a year that he would have to go to the doctor to get his blood tested and also to get a lung x-ray. In addition to the amount of time that took, every single day, Michael had to do lung treatments. So I had to teach him how to do his lung treatments. In addition to that, I had to sterilize his equipment every few days. So it is quite a time-consuming disease to have, since you have to do lung treatments every day. Anytime you have a child who has a chronic illness that cannot be cured, emotionally it's very difficult.
There's a lot of research being done on the types of bacteria that patients cough up, and some of our docs are looking at that and seeing the type of things that can be done to help limit or lessen the bacteria load in patients.
I know that there's research done right now on animals that would actually change the mutation that causes cystic fibrosis so that these animals no longer have cystic fibrosis. I heard it's working well on the animals, but I also heard that it's very difficult to get these medications to work in humans. I'm hoping, though, that the scientists will be able to figure out how to get these medications to work in humans, because then they can actually change the mutation that causes cystic fibrosis and make it into a healthy gene, which means that Michael would no longer have cystic fibrosis if they could just change the gene.
I would say that I'm very hopeful for the new medications that are coming out for cystic fibrosis, and I anticipate that I'll actually be able to use some in my lifetime. Maybe I won't have to do all this stuff every day, and maybe I won't have to take the pills when I eat, and maybe I'll feel well. But yeah, so I'm very hopeful overall, and I think that, you know, looking back on cystic fibrosis, like 100 years from now, they'll be like, man, people used to have this problem, and it's kind of like we don't have this anymore, you know. So I think that, especially for like my kids and posterity down the line, they won't have to deal with this.